Hello, hey guys. Thanks for coming out again. Today we have a fun one. I mean, it's not so fun if this is you, but we're talking about jaw dislocation or TMJ dislocations today. You could be the patient, you could be the doctor or the nurse or anyone involved in the whole scenario. I'm going to show you how to relocate a jaw. You could do this on yourself if you dislocate your jaw, or someone can do this to you, or you can help out, or you can be just some advice for some people on what to do. I'm We're gonna look at this one TikTok that got pretty popular recently. This girl dislocated her jaw, and she just seems happy-go-lucky. But for most people, it's not like that. It's pretty painful. It's pretty painful. So this is basically your TMJ. So this is the condyle of your mandible, and it's usually within this little fossa here, the glenoid fossa. So when you open and close a little bit, your jaw is just rotating. So that condyle is just rotating in the fossa. Say you want to eat like a double Whopper or something and you want to open really wide. So what's going to happen is it's going to rotate, and then after a while, about an inch or so, it's going to start translating. So this bone is going to move and slide across this eminence. Normally this eminence is a little bit more of a bump here. This one's kind of flat. But normally you're in the joint and it's just kind of rotating and sliding a little bit. If you open really wide, now you have the potential to have this condyle pop over the eminence here and get stuck. You need to do this when they're completely as relaxed as possible. Otherwise, it's not going to work, and it's going to be a lot more painful for them. So I'm doing that. At the same time, I'm just waiting for the time when I feel that they're at their most relaxed state. And then you want to do a quick motion where you push down and back. And so what you're doing is, remember that condyle in the fossa, you're trying to pushing it down to get over that hump and then back into position. Ever since I left the city, All right, so we're just going to get into this TikTok that's been floating around recently. Here it is.
She's Lockjaw. Her last name? Sinatra. First name? Jenna.
Obviously, can't close your mouth, drooling all the time. You're losing a lot of moisture that way too, right? It's usually a lot more painful than this, by the way.
Really? I'm
sorry to laugh.
Getting her x-rays. Yeah, you're dislocated.
It hurts when you do that? Mm-hmm. So she's going to start an IV and we're going to give you some...
They're going to sedate her.
Stuff.
Didn't really try bedside.
Okay.
Okay?
Mm-hmm. What does the muscle actually do?
Just relaxes your whole body.
That's basically it. She's just documenting her experience before the actual procedure. They gave her some muscle relaxants. I'm not sure what that was, but something. So that's that. So what's really happening here? I'm going to put this little graphic up here. So anatomically, the temporomandibular joint, it's usually in that fossa, and you can see on this graphic it's just moved forward, and it's over that eminence or the hump there, and it's stuck. And I'm not going to talk much during the video because I want you to hear what I'm saying and how I'm trying to make sure that the patient is relaxed enough before I do anything. And while I'm talking to the patient, I'm also kind of feeling and gauging their level of relaxation. And so I want to make sure that they're relaxed, their tongue is relaxed, and all that stuff. So here, let's just get into the video. You're good. You don't have to do anything special. Just relax your tongue. I don't want any tension. Tongue is a little tense. Like jello, okay? They're not ready yet. Just relax your tongue there. I just want you to relax your tongue. So it's a little still tense. Checking the tongue. Like, it's still pretty tense. The floor of your mouth, like the bottom of your mouth, like jello. Okay? And just relax. If you want to close your eyes and relax, it's whatever is easier for you. Relax your shoulders. And you have to talk nice and soft, okay, too. And just relax. Nice and relaxed, okay? And just relax your tongue there. Close it. Don't open it. Don't open it. You can see that she's pretty happy. It also hurt a little bit, but she's pretty happy, and she's happy that it's over. Show me your teeth. The ordeal is over. So that's that. So hope you guys enjoyed today. It was an interesting one, and like I said, this is not going to work in every situation, but it works most of the time. So it's something to keep in mind. If you're the patient or you know someone who, has a dislocated jaw, or if you're in a treatment capacity to help people, so you could be anyone, right? So that's basically it. Hope you liked it.
Yeah, we pass around the beat like a joint. If you're taking up my time, I'ma hit the invoice. Pass around the beat like a split.